So what this slide shows are the three transitional stages of menopause. So we have perimenopause, menopause, and postmenopause. So perimenopause can last 4 to 8 years, and it is it's the time when symptoms are more severe due to fluctuating hormones. So what I put up there is average of 3 to 4, but it can last between 4 to 8. That is the range. So, you know, it's quite a long process. Menopause occurs when a female ceases to have periods for 1 year and 1 day. And the 1 day is significant because a lot of people don't realise that you are actually only in menopause transition for 1 day. You are in perimenopause, and when you haven't had a period for a 12-month consecutive period of time, on that 1 day after the 1 year, that is termed menopause. The day after, you are then in postmenopause. So it's only 1 day in the whole of the cycle and the transition. So women usually transition through the menopause between age 45 and 55, but not all women will transition through the perimenopause stage. So for example, women who undergo cancer treatments or full hysterectomies like myself, also known as a bilateral oophorectomy, a term meaning the removal of a woman's ovaries and womb. So it's the ovaries that produce the hormones that affect women through menopause. So what happens is, as you go through the transition, your hormones change, your hormone levels change. And this is why, for those people who go for blood tests, if they're under 45, because when you could present at your GP, they will generally not send you for a blood test to test for menopause or perimenopause until you've reached, if you're over 45, the doctors or your GP will automatically assume that what you are presenting with is menopause if the symptoms align. Anyone under 45 can ask for a blood test to check their hormone levels. However, people can have up to about 3 blood tests to identify the true result, because hormonal levels it's like a roller coaster, and I'm sure some people feel like that. It's up and down on a daily basis. So you could have a blood test today and it could say that you're not perimenopausal. However, in a couple of days, depending on when your cycle falls, you could end up proving that you are perimenopausal. So that's something to consider when you go to your GP.